Dr. Pisarenko here from Plastic Surgery of Westchester, and today we're going to talk about tummy tucks. More importantly, what should you be asking during your consultation for an abdominoplasty or a tummy tuck? First and foremost, what type of tummy tuck are you a candidate for? We're not all built the same, and one size doesn't fit all. So there are certain patients who are candidates for something called a mini tummy tuck. Other candidates need a standard tummy tuck, which is an incision that's hip bone to hip bone. Some patients need an extended tummy tuck, which goes beyond the hip bone onto the sides. And some patients need a circumferential abdominoplasty, meaning that the skin is removed all the way around to the back. The next question is, where are my scars going to be placed? When I have a consultation and we discuss the incision, I usually ask patients how they wear their bikinis or their underwear. So we try to hide the scar within your bikini line. We also talk about our ability to place a scar at the site of the previous C-section scar or below it. Sometimes, depending on the anatomy, we are forced to move the scar up. But again, all those things depend on your anatomy, depend on your skin laxity, as well as the ability to move the tissue down when the tummy tuck is done. The next question you should ask is about your muscles. Are your muscles going to be repaired? Vast majority of patients undergoing abdominoplasty or tummy tuck have something called diastasis recti, which means that the muscles are separated and there's an area between them and there's some distance. So as part of the tummy tuck, what we do is we repair those muscles. We bring them back to where they're supposed to be, which is in the midline. It's important to discuss this with your surgeon because I think it's a very important part of the operation. The next question is, how do you create a natural belly button? Well, that's the art part of the procedure. Everyone has a different way of doing it. It really depends on patient's anatomy. It also depends on position of the belly button. But for the most part, what we try to do is create a belly button that is dipped in the area, meaning that there is a valley in that area where the belly button sinks in and the scar is actually inside and it's well hidden. Another common question that we get asked, and I think it's important to speak to your surgeon, is longevity of the results. So of course, this procedure eliminates the extra fat and skin below the belly button and tightens your abdomen. However, it's really important to maintain your weight and health after the procedure. Certainly, if somebody yo-yos up and down 25, 30 pounds every couple of years, that skin is gonna expand and shrink, and certainly the result is not going to be the same. So it's important to follow your surgeon's postoperative instruction.